And joining us on New Day this morning is Dr. Jose Paciano Reyes. He's a neurologist from the UP-Philippine General Hospital. Good morning and welcome to the program, Doctor.
Good morning.
Now, President Duterte came back, as we all know, earlier than expected from Japan because of, quote, excruciating pain in his pelvis and spinal area. And we also know that the President fell off his motorcycle last week. Do you think there could be a connection between him coming home early and his accident?
Well, that could be possible. When you fall off, of course, you can injure your back and you can have back spasms because of that. Or what they were actually ruling out, whether he had a root compression from his lower back, which by MRI didn't show anything.
Right.
So what he had was kind of a nociceptive type of pain, which is, pain due to injury to tissue. It's usually protective, in that sense, as contrast to a neuropathic pain, which is due to injury to a nerve. Like, as an example, would be a lumbar radiculopathy, which they tried to see if the President had.
Okay, so just trying to dissect what you just said, the pain that the President was experiencing, excruciating, these are all congruent, or no? These are all expected for this type of accident at his age?
Yes.
Okay.
Possible.
So going back, Mr. Duterte is 74 years old. How do you think age factors when it comes to recovering from an accident or any illness for that matter?
Of course, when we grow older, although I'm not a geriatrician, I'm a neurologist, healing process does slow down a bit. But in general, if you're in good health, even if you're much older, there should be no problem from recovering from minor injuries. No? And when you're 74, or in general, when we grow older, we get a little weaker, our coordination is a little off. So one of the things we really watch out for and advise our patients would be fall prevention because of these things.
Okay, so going back to the accident, what are some of the possible injuries that one can expect from an accident like this?
Well, of course.
And this could still be considered a motor vehicle accident, aside from just a fall.
Well, of course. Of course, as a neurologist, we get referrals a lot. And of course, the worst type of injury you can get is a head injury.
Right.
Okay, and of course...
But in this case, good thing to know that the President was okay. I think he was given the all-clear sign. So it was just... So is it expected for this type of injury that it can be just localized? Kumbaga, what the President is experiencing right now is expected for this type of injury. It's not sort of underrated or overrated as well.
Yes.
Okay. So Senator Bongo says that after the President got himself checked, the doctors were saying that the pain is just muscle spasm. So could you explain to us what exactly is a muscle spasm and why does this occur?
Well, it's a type of nociceptive pain. So, when a tissue gets injured, you get pain. And sometimes the response of the muscle is actually to contract.
Okay.
In a way, for example, when you fall and you try to break a fall, your muscles try to protect you by tensing up. Unfortunately, they can get pulled.
Okay.
No? And when it gets pulled, then you tear some of these small muscle fibers, and they get inflammation, and then you get the pain. And so essentially, that's what the pain is.
This type of injury, do we expect a full recovery from the President? Do we see any lasting effects from this type, or can he?
You can recover. You can recover from muscle spasms and from minor injury to the muscle.
Okay.
Might take some time though.
Okay, so how about treatment naman, Doctor? So what type of treatments can be expected the President to go through with this type of injury? Is it okay because they said pain relievers lang kailangan for this type of injury?
Yes, pain relievers are part of the therapy or treatment, but for our patients who have pain, muscle pain, we usually ask them to undergo some form of rehab, and of course some modification problem the way they would do things, or move. Yeah.
So, on your expert opinion, Doctor, there's been a lot of speculation, so we just want to make things clear because the President said that he also has myasthenia gravis, and some people might speculate that these types of symptoms, the excruciating pain, the weakness and all that, may be because of that. Would you be able to say that some of what the President is feeling is maybe due to myasthenia gravis? Is it consistent with that?
So when we talk of myasthenia gravis, myasthenia gravis usually does not present with pain. Okay, it usually presents with some form of weakness. Okay, but not pain.
Okay.
There's no pain in myasthenia gravis.
Okay, so we could be more than confident to say that the pain that the president experiences, injuries, is localized, and due to
Some
muscle spasm secondary
musculoskeletal,
to the fall.
Yeah.
Okay, very good, very good. So with that, we'd like to thank you, Dr. Jose Paciano Reyes, for sharing your insights and clearing up a lot of things.